Welcome once again, as usual. It's another journey that we are embarking upon, and this time it has to do with the oldest. I'm sure it's the oldest infection ever lived, because when you are talking of mycobacterium species, the Mycobacterium leprae, you are now talking of the same genus that causes tuberculosis, mycobacteria tuberculosis, and from all indication it has been from time immemorial. So, but I shall be taking on mycobacterium tuberculosis. How can we avoid it? This is something that has lived almost forever. How can we avoid it? It is estimated that 1 in 4 people in the world has it. Though you will not see people coming down with infection, with the sign and symptom, but they are already harboring the virus asymptomatically. They are not showing overt sign of sickness. They are called latent TB infection carriers. So they are carriers, and all we can do to help ourselves is to detect these latent TB carriers, that is the asymptomatic people. If I do the test and I confirm to be a latent carrier, immediately I start the treatment, and I may never come down with tuberculosis, because the latent carriers, the moment the immunity of that person is compromised, once it's compromised, that's why it's so easy for the person to now come down with a full-blown tuberculosis. And these days we are having experiences of antimicrobial resistance. There are multiple drug resistance tuberculosis. So that is another area of fear, where no drug will be able to treat the tuberculosis. And luckily enough, there is a way that is also taken care of for now. So if you find this interesting, if you find my channel very good to your taste, please subscribe, like, and let's continue to build more. I shall go into full details of how to avoid tuberculosis. How to avoid TB. It's very essential that we go through the infection, the prevention, and control. Tuberculosis infection could be classified as new incident altogether. That is when it is affecting and you have the TB coming out. Then there is the other one that there is no overt sign of TB. That is the LTBI. These are the shape of the macrophage. That's the nucleus, the nuclei, and what we're seeing is the lysozyme demonstrating the flagella that way, and the cell itself, the macrophage, is engulfing the bacteria, and the lysozyme, the enzyme, will digest it. But at times it may not digest, and it goes on to become the latent TB infection. But the latent does not really infect other people. So let's talk about how to avoid the primary infection that will go on to spread amongst people. The asymptomatic infection does not spread from person to person, but the tuberculosis itself, when it's showing that sign, will spread. So you talk at a distance, let there be cross ventilation. The active TB patients are usually advised to use white handkerchief. Acquire knowledge on the telltale signs of TB, which includes cutaneous tuberculosis. These are extrapulmonary tuberculosis. A rare extra tuberculosis, this results in what we have here. For example, the cutaneous type. You can see the shape of the graph there. This is the coloration of the hair. Avoid drugs that lowers your immunity. HIV patients are immunocompromised, so they can easily come down with the TB since the infection itself is there. Poverty, overcrowding, and malnutrition are risk factors, so it pays to be vaccinated before venturing into areas like this, or alternatively, it must be in the open space. or well-ventilated area. You can also talk about eating balanced diet to build your immunity. Once your immunity is strong, the latent tuberculosis infection will not turn to the active form. Prevention of that active tuberculosis. Tuberculosis is now the second most deadly infectious disease in the world, behind only COVID-19. Prevention target treating the LTBIs, that is that latent infection, which may turn back to be tuberculosis itself. Always cover your mouth and nose when you cough or sneeze. TB preventive treatment stops TB infection from progressing to disease in those who are infected and can protect both the individual and the community from TB. The tuberculosis prevention treatment. When you are now talking of treating this, there is a detailed guidance on how to implement the WHO evidence-based recommendation on TB infection. What do we mean by evidence-based? That you must have confirmed that there is evidence that that person has TB, even though it is not over. That is, the tuberculosis bacilli is present in that person. And the tests that are usually performed are the standard PPD skin test is done, which when positive is further confirmed with quantiferon gold, and if positive, then treatment is commenced. This is also could be combined. The X-ray, when you look at the tobacco in the X-ray coming out like a dot or millets, after you must have gotten a PPD positive test, then you have confirmed that this person is harboring the TB infection, but it's not showing the overt sign, and so treatment can be commenced immediately. Control of tuberculosis. Vaccinating healthcare personnel working on TB specimen or TB patient is also very important when we want to control tuberculosis. Implement a respiratory protection program, especially because when you talk of hospital-acquired infection, you must always take care of the health care personnel and the kind of face masks and coat that they use, like the COVID-19 experience. Educating patients on respiratory hygiene and the importance of covering their mouths and their nose when they feel. The active infection and miliary infection is the wetness. Pulmonary infection is primarily when the TB infect the lungs. The lung infection is what is called the pulmonary infection. It is from the lungs that it can establish itself and bring out the symptoms and signs. Coughing, night fever, and what have you. The person is wasting, and you can see what happens to the lung. This is showing the lung infection. That's where TB aspirate election from. Then there are those who move from that area after probably being engulfed in macrophages that carries them to the lymph node, and from the lymph node to the other parts. For example, this is extrapulmonary infection affecting the side of the ear. It's a very rare infection, but it's common. It can affect the kidney, affect the brain. The miliary tuberculosis is when it starts spreading through the blood to all the organs of the bodies. It can, like I said, affect the brain, and when it's miliary, you can see the granuloma. It's seriously obvious. This person is, if not care is not taken, it might die within the space of time. The diagnosis is here, where we now talk of TB-like lesions, how to take them up and do the needful. Also, identification of the microorganism using the microscope, the acid-fast staining, Zn staining, the fluorescein staining, rhodamine, and the histochemistry is also a way. Then the culture too, you look at their cultural characteristics and the biochemistry to really say what you have here is mycobacterium tuberculosis or bovis or any of the other species. Molecular method is very diagnostic tool that will tell you this is what you have, the mycobacterium type. The cell-mediated immune-based test, we have mentioned the skin test, the PPD, the IgR, and even the PCR on cytokines expression. So these are tests that will confirm that truly is evidence-based, and you can also do ELISA and all the other stuff. Treatment, that is also a point of concern, where sensitivity testing is on a lowest ingesting medium, or you use Middlebrook 7H10 agar. Indian implements universal drug susceptibility testing using rapid genotypic test and line probe assay to bridge the gap of diagnosis of multi-drug rifampicin-resistant TB. So that's the progress made. Biopsy method is the reliable tool for diagnosis of not only pulmonary tuberculosis but also other organs tuberculosis. So you can extend that, and this is when you are talking of multi-drug resistant TB like what we have there. The culturing from the sputum, not the blood that is used in the universal drug susceptibility, and these would come out with color differentiation after some weeks of cultivation. The multi-drug resistance will show the color change.